This is DITW Anatomy and Physiology, and this video is on the anatomy of the heart. When we open up the heart to look inside, we can simplify the anatomy of the heart into a couple of different categories. We have a myocardium, which is the muscular wall that's built of cardiac muscle. We have 4 chambers which the blood passes through. We have 4 valves that the blood have to pass through into each chamber and to the lungs and eventually to the body. And we have 5 blood vessels, and these blood vessels are the passageways to the various organs of the body and the starting point and ending point for the passage of blood through the body. For the 4 chambers, we have the right atrium, the right ventricle, the left atrium, and left ventricle. The 4 valves in the heart are the tricuspid valve, which split the right atrium and ventricle. You have the pulmonary semilunar valve, which separates the right ventricle from the lungs. So essentially, when the right ventricle contracts, that will push blood past this particular valve. You have the aortic semilunar valve, and when the left ventricle contracts, it will push blood into the aorta. And then we also have the bicuspid valve, which is the valve which separates the left atrium and left ventricle. You have 5 blood vessels, the superior vena cava. So this is the blood that is been deoxygenated, that is returning from the head. You have the inferior vena cava. This is the other vein which is returning blood from the rest of the body. You have the pulmonary vein. This is the passageway for blood to the lungs to become oxygenated. And you have the pulmonary artery, which is the blood that is returning from the lungs oxygenated back to the heart and into the left atrium. And then you have the aorta, which blood from the left ventricle, after it contracts, will be pumped into this aorta, and this is the primary artery which then brings blood to the rest of the body. Thank you very much for watching. If this video was helpful, please make sure to like. If you have any questions on anatomy and physiology related topics, please comment, and make sure to subscribe to know when more videos are available.